Oh my God, Amy, it feels like it's been too long that I've actually seen you.
We haven't seen each other in person in ages, but I haven't been to any conferences in a while, so
Yeah, I try to avoid. There's only one. I only go to SMA, SMHP and a couple other ones, but pretty much SMHP conferences. But I'd love to connect with you again. So I think we're alive now. Let me just make sure that's all working and let's get going. Okay, appears like we are actually live now. All right. Guys, this is Dr. Tro Kalasian. I'm here with Dr. Laura Buchanan and the great Amy Berger. I am going to do a brief introduction. We're going to be talking about Alzheimer's today. If you are interested in joining the conversation, you can come to our app, you can join the meeting, and you can ask questions. And we'll be responding to questions from our app. And, we have our health coaches in the background here that can help, queue up some of those questions maybe. And but we're gonna have a lot of fun. A couple of announcements for people joining us. We have our meetings tomorrow. Vic just told us about them, our health coach. We have a mini meeting tomorrow if you guys want to join us from the social community on our app at 3 p.m. Eastern tomorrow. And I think that's the only other announcement we have, right? Oh, and Dr. Laura is doing states on Thursday, so for tennis. So we're excited about that.
And
So today,
Thursday, fasting on Thursday.
oh yeah, I'm
No,
so sorry. Yeah, join Tia and join Vic. Okay, a combined, I don't know, 30 medications stopped between two of them, probably around 200 pounds dropped amongst the two of them. Total lives change, and they both utilize fasting. So if you need help with fasting, we have a fasting support group, and that is on Thursdays at 12 Eastern, also on the app. But let's get started with Amy Berger. If you've lived under a rock and you're just joining me on from social media somewhere because I said something silly, well, now I'm going to say something smart. Amy Berger is a must follow everywhere. Okay, everywhere. She's got a master's and she's certified nutrition specialist, master's in human nutrition. She's written 3 books that I know of. End Your Carb Confusion, The Alzheimer's Antidote. Please, awesome books. And I can't forget, there's one, Stall Slayer, I think was the third one. I can't forget that one. Love them all, particularly loved Alzheimer's Antidote. Get it on Amazon. End Your Carb Confusion with Dr. Eric Westman. Amazing book. She's got a YouTube, which is awesome. And we just love Amy Berger. That's it. We just love Amy Berger. That's it. That's the truth. So we're so happy to have you here today. We also have Dr. Laura Buchanan, internist, board certified obesity medicine doctor, metabolic health practitioner from the SMHP, and on the board for the SMHP. And she is going to kick off our discussions about Alzheimer's because if you haven't been following the news, there was a bombshell that came out about Alzheimer's, and it's huge. And we got hints of it a couple of months ago, but the nail's in the coffin. And, Dr. Laura Buchanan is going to talk about that. And I can't wait to hear what Amy has to say about it.
Yeah, awesome. Thank you, Tro. I've just got just 2 quick slides I'm going to share here. And so and I'll just start. There's some of the data about ketogenic diets and Alzheimer's that is coming out is really exciting. Whereas there's been now a few decades of research on amyloid beta that NIH has funded for pharmacologic interventions and amyloid beta research that's at over $1 billion per year now. And unfortunately, in these past 2 decades, there hasn't been a lot of significant benefits that have come from that. And just in the past few weeks, one of these papers that really sparked a lot of interest in research in this area is actually being retracted. And so I just wanted to spend a few minutes on why part of the reason it's being retracted and explain that before Amy starts. And so this is the paper. Here you can see the title, and this is a quote from it. I'll just read. Oh, I got to minimize this. We found that memory deficits in middle-aged mice are caused by extracellular accumulation of 56 kDa soluble amyloid beta assembly, which we term amyloid beta star 56. It's purified from the brains of impaired mice, disrupts memory when administered to young rats. We propose that amyloid beta star 56 impairs memory independently of plaques or neuronal loss and may contribute to cognitive deficits associated with Alzheimer's. So in layman's terms, they found a protein in these mice, and they were actually then able to extract that amyloid beta and inject it into young rats and cause memory impairment similar to Alzheimer's. So that would be a really exciting, important discovery. Now, this is the actual Western blot here that they used or had in their study that they published. And if we go and zoom in, and this is what they found, if you look at this Western blot, these images are perfectly identical, these two lines here. And the odds of that happening on a Western blot are basically impossible. That means that the image has been edited, and that there's been now several other Western blots and other images that they think that have been published that are actually false. And the immediate obvious damage of this is a big, decrease in trust and research that is out there, but also there's a huge amount of wasted NIH funds and wasted thinking in the field, because this experiment published in 2006 was actually a huge kind of instigator to a lot of the research that followed it. And people use this research as a basis to formulate and start their own experiments. Now, I am very hopeful that more research is going to continue to be done on benefits of lifestyle changes, ketogenic diets, and preventing and reversing cognitive impairment. And so I'm stay optimistic despite the loss of trust coming from researchers like this who are falsifying data. And with that, I would like to pass it off to Amy.
Yeah, hey everybody, it's nice to be here. I had actually prepared a whole talk with slides. I thought this was going to be more formal, but I'd so much rather have it be less formal. Yeah, this amyloid thing has really, I think, sent research efforts and dollars and focus down the wrong path for decades, and we are suffering the consequences because of it. And there's several papers showing that, amyloid upon autopsy, when people's brains are examined, there are people who die from severe or die with severe dementia, severe Alzheimer's, who are found to not have a whole lot of amyloid buildup at all. And there are people who die of other causes who had no cognitive impairment, no signs of Alzheimer's or any cognitive problem. And upon autopsy, their brains do have a lot of amyloid. So if we have people who have a lot of amyloid, but do not have any cognitive impairments, and we have people with severe cognitive impairment who do not have a lot of amyloid deposition, then amyloid cannot really be causing this disease. There's got to be something else going on. And it's really incredible that there have been several different pharmaceutical drugs developed over the last several years to specifically target the amyloid, to either reduce the amyloid formation or help to clear it away. And these drugs work. They work in that they reduce the formation of amyloid. But what they do not do is have any beneficial impact on the actual cognitive function, on the progression of the illness, on just the cognitive function of the afflicted person. So if we target the amyloid effectively and it has no positive impact upon the disease progression, how can we not assume that we've just been targeting the wrong thing?
100%. I'm a little bit concerned, actually myself, because we've this body of this particular paper that was retracted, it was cited over 2,000 times, I believe. Laura, you tell me if I have it wrong.
No, that's
And
right.
this was the original paper that really promoted the idea that, wait a second, maybe, maybe, that amyloid is behind Alzheimer's. And remember, from your book, we know that insulin resistance is such a hugely linked, part of this disease, right? And we have studies showing that, going on a low carb diet can improve sort of cognitive impairment. You can get some modest improvements in cognitive impairment. I know they're testing some ketone supplements as well. And I feel like we've just missed it, right? We just missed it in this effort to pursue drugs and the amount of money that's gone into research. I mean, this is like
$1 billion per year, 1.6 billion just on amyloid alone.
right? The
Yeah.
amount of money that's gone into research that could have gone into like funding the SMHP, right? Or funding, ketogenic diet trials. It got pumped into these pharmaceutical drugs. And one of them was just approved. I don't know, Laura, if you mentioned that or not before or after we started live streaming, but one of them just got approved and it was like, it has no effect on the disease. So I just, help me understand. One, should we be looking to pharma to solve our Alzheimer's problem, our dementia problem, our brain problem? And if we shouldn't, which I mean, my opinion, I don't think we should. What are the things that the person listening to, because there's going to be people who have a mom with dementia, a father with dementia, a grandmother, grandfather with dementia, or they have dementia in their family and they want to do everything about it. What are the step-by-step main things they have to know? And I know for you, this information isn't new. Everybody's read about it in your book, but for the people who haven't read about it in your book, what are those, how does it make you feel to see this type of fraud in the, dementia literature? And then what do you think people should do now, since pharma's not going to help you?
It's there's a lot of questions in there, but my first thought is that it's heartbreaking to see, and I really don't think that most people have ill intent. I think most researchers are well intentioned. I think even the pharmaceutical companies, they're out to make money, yes, but they're out to make money by developing drugs that at least theoretically actually do something positive. So I really am not a conspiracy theorist, but it is heartbreaking to see some of this being preyed upon people who are absolutely desperate for help. I mean, that's at least with something like diabetes, or there's so many other conditions where there are treatments. They may not be that effective over the long term, but there's something to be done. With Alzheimer's, you're kind of out of luck, right? At least as far as the conventional treatment world is concerned, there's just nothing we can do. And so to offer so much false hope, oh, these monoclonal antibodies, oh, this anti-amyloid drug, and every single one of them has been a failure. And I think Gary Taubes would phrase this as, this reflects the fact that we have a fundamental misunderstanding of the disease process. If everything we're trying to do to fix the disease is not working, then we need to go back to the drawing board, because we clearly misunderstand the disease at its root. And, Alzheimer's is not brand new, but it used to be really, really rare, just like type 2 diabetes and cardiovascular disease and colon cancer and all these things that are just rampant now. This is something that has just exploded. And those of us here, and hopefully a lot of the people watching elsewhere, have come to appreciate that things like type 2 diabetes are just what I call chronic hyperinsulinemia, just conditions that are associated with chronically high insulin. It affects the entire body, right? We have enlarged prostate, PCOS. So we know it affects the reproductive organs. It affects the skin tags, acanthosis nigricans, acne, like joint pain, cardiovascular disease, fatty liver, all kinds of things. Why do we think that the brain is immune? why do we think that the brain is somehow protected against the effects of these metabolic issues that affect literally every other part of the body? And I think if we could have a fundamental shift in perspective of what is actually causing this. And I'm not saying that we know 100%, but the research certainly much more strongly supports a metabolic connection. And when I say metabolic, I mean energy, right? Metabolic is how your body generates and uses energy. And if this is, I know a lot of people here, you've heard this over again, you've probably seen me talk at conferences, but for anyone who's brand new, the number one thing you need to know about Alzheimer's disease is that the primary problem is that the brain has lost the ability to take up and metabolize glucose properly. So the brain basically is starving to death. It is a fuel shortage in the brain. And there's a lot of reasons why this might be happening, but having type 2 diabetes or insulin resistance massively increases your risk for Alzheimer's. And this is regardless of your family history and regardless of your genetics. We could maybe talk about the ApoE4 thing if we have time, but
We should
type
talk
2
about it.
diabetes and insulin resistance are independent, massive risk factors for this.
I think we should talk about it. We know that, it's so interesting the way you talk about the brain and being an organ, and we take it for granted, right? Similarly, when patients have seizures, similarly, when patients have migraines, similarly, when people have mental health issues, I try to talk to them and talk to them that the brain is an organ, and the brain, just like if you rolled your ankle, right, you'd rest it, you'd seek to decrease the inflammation in the ankle, you'd look to, move it around just enough that it heals, and you really wouldn't put any extra strain on it. And you can very easily put strain on the brain, and people take that for granted. Don't sleep, sleep late, sleep late, don't sleep, and you'll put strain on the brain. You can actually induce seizures if you want to take somebody who has mild cognitive impairment and make them really not function, sleep deprive them, right? Sleep deprive them. And simple things like, we know it when it sort of comes to kids, like, but we certainly see it in the elderly. And in those, I shouldn't say elderly, I should say people with dementia. When you give them a diet that's lacking basic nutrients, they don't do well. Right? When they're basically, living on that roller coaster you so eloquently drew in Endocarp Confusion, that's not a way to live. And I think when we go back to that idea that the brain is an organ and it needs help and it needs support and it needs love, it needs attention, and like the basics, good diet, good sleep, plus or minus good supplementation, some of the basics. And I'm just curious, what do those basics look like for you when you're sort of giving that prescription, that lifestyle prescription, or the diet prescription, or the exercise prescription, or all of the above?
Well, first, I could not agree with you more about, the brain being an organ. And I'm sure a lot of people here know Dr. Georgia Ede. She's always saying, people talk about the mind-body connection. Well, yeah, of course, last time I checked, the brain is inside the body. So I think there's probably a connection there. So, I mean, the basics for me are eating in a way if diabetes and insulin resistance are huge risk factors for this, then we want to eat in a way that keeps those things within a healthy range. And I'm very careful to say that rather than everybody needs a keto diet, right? I mean, I think keto is great, low carb is great. Not everybody has to follow an ultra strict ketogenic diet in order to protect the brain. That's one way to do it, but certainly there are people out there who can eat certain amounts of fruit and sweet potatoes and just higher carb foods and not have these massive increases in blood sugar and insulin. So I think just following a healthy diet that gives you all the micronutrients you need, like you said, sleep, I know just from my own mood, if I don't sleep well, you better watch out the next day. I mean, you better steer clear. And the thing with and Tro, you said it so well. It's not even so much elderly anymore. People are being affected younger and younger with this, just like type 2 diabetes. Now we have, preteen girls with PCOS. So all of these metabolic conditions are affecting people younger and younger, probably coming from the changes in our food supply over the last few decades. But the older people specifically, I think, face even more obstacles to healthy cognitive function. And that includes things like statin drugs, where these are absolutely known to impair cognitive function, at least in some people. And that's directly from the FDA's website. I'm not like telling stories here. Certain types of statins are more likely to cause cognitive problems than others, but they do have the known side effect of memory loss and confusion and stuff like that. Elderly people, not just elderly, but people who have been taking antacids for a long, long time, you are kneecapping your digestive function. So you might not be, I mean, a vitamin B12 deficiency all by itself can cause neurological problems. Forget all this glucose insulin stuff. A B12 deficiency alone can induce some of these issues. And I think B12 deficiency especially is rampant among older people, and it's not a standard test. And there's just other factors at work that I think the metabolic aspect is a huge part of this, the glucose insulin thing, but it's not the only issue. I just think we have so many assaults, if you will, like coming at us from all sides in the modern diet and lifestyle landscape. Doesn't mean we can't get around them, but we have to know what these obstacles are to be able to, protect ourselves against them.
Yeah, for sure. And just from a practical kind of clinical anecdotes, but very common in our practice, I have patients who are in their 50s and they say they suffer with a lot of brain fog, or they feel like, what would be considered the early stages, mild cognitive impairment. And they come see us, they go on a low carb ketogenic diet, changing their lifestyle, and the brain fog goes away. The mild cognitive impairment symptoms they had totally resolved. So I think that's another thing that just excites me. And you see people getting so much better rather than that kind of slow, steady downward progression, just with lifestyle.
Yeah, I mean, we hear that a lot, that sort of anecdotal, oh, my brain fog is gone, I'm thinking so much more clearly. And I wonder if there could ever be an actual clinical trial on that. I mean, how do you define brain fog, right? I mean, at least with Alzheimer's, there are diagnostic tests, whether how reliable they are is questionable, but there's some sort of standard evaluation. But yeah, we hear that all the time with just sharper thinking, and whether that's just being off that blood sugar roller coaster and having steady, levels, or generating a little bit more ketones to go and fuel the brain. Either way, this way of eating helps the brain. And that's always been one of the most encouraging things to me in the Alzheimer's research, is that, and again, for anyone that's brand new to this, if the major problem in the brain of somebody with Alzheimer's is that there's a fuel shortage, and it's been shown over and over that this fuel shortage is specific to glucose, well, hey, what do you know? The brain can also run on ketones. What a handy little fact that is to know. How can we maybe get some ketones to fuel the brain? So, and it's not a slam dunk. I mean, I'm never going to suggest that a ketogenic diet is some kind of miracle cure for Alzheimer's, but if the main problem is that there's this fuel gap, and we know that ketones can help to close that gap to at least some extent, then let's get our brain some ketones.
Yeah, and from the research I've seen, even in these individuals who have trouble metabolizing glucose and that hypometabolism, they don't have any issues with metabolizing ketones. And the ketones can actually, the ability basically to use them can get upregulated on a ketogenic diet.
Oh yeah. I mean, that's, even though for whatever reason, the Alzheimer's brain does not take up and use glucose as well as it's, supposed to, it takes up and uses ketones. And There's a researcher named Sam Henderson who's written some really great papers, and one of his papers has one of my all-time favorite lines in the entire medical literature. And I'm going to butcher it. It's something to the effect of, like, one of the drawbacks of the modern high carb diet is that it is keto deficient. Meaning that anyone who's eating, upwards of 50% carbohydrate every day is never really going to be generating ketones. Whereas, evolutionarily, we probably went in and out of ketosis seasonally, or, here and there. Maybe if, hey, the hunt was unsuccessful, I guess we're not eating for the next 3 days. I guess we'll be in ketosis for a couple of days. So it may not be that people lived in ketosis forever, but there would have been periods of time where this was happening. And the modern diet is keto deficient. I love that.
I've often wondered what was whenever I think about sort of medical anthropology or evolutionary purpose, right? It kind of makes sense. If you're without food longer, do you want to be frantic and sort of, all over the place, or do you want a bit more focus to go get your next meal, right? And I wonder if that bit of ketogenesis, or being ketogenic, it served as a function to sort of guide the brain, like, hey, you can actually focus a bit more now and go get that hunt. I've seen some data showing, a couple points of improvement on sort of mental status, evaluations, which I think it's not bad. I mean, it's better than some of our drugs. Our drugs are really clinically insignificant when it comes to treating, dementia. The mainstay medications, I don't think they have more than a 2 or 3 point increase on some of those cognitive assessment scores, meaning like, it's like a 5 or 10%. It's almost nothing. And so this idea of getting back to the basics, sleep, good diet, movement, sunlight, sleep, I think I don't know, it's very attractive to me, and I'm curious if you've seen any sort of amazing shifts, amazing changes that you'd be willing to share,
So in my experience, unfortunately, the majority of people who come to me for help are the adult children of someone who's already institutionalized. And if the food supply is out of your control, you're kind of out of luck. I mean, I hate to say it that way, but that's really the truth. If you can't control what they're feeding this individual, you're really going to have a hard time making a dent in anything. There's some published research, and it's this is one of those areas where, kind of like Tro, like you and Dr. Lenskis have seen in your practice, you have seen things that are not reported in the medical literature yet because nobody's looking for it, right? Or nobody believes you. But like with addiction and stuff like that. And for me, a lot of the research that has been published is using exogenous ketones, or MCT formulas. And I think it's because they want to eliminate as many confounding factors and other variables as they can. So if all they're doing is just elevating the ketones and somebody gets better, well, then they know it's the ketones. Whereas if they put somebody on a ketogenic diet, there's so many other factors at work when you change somebody's food versus giving them just give them the ketones. So the research, it's very promising. A lot of people do have cognitive improvement with these ketogenic interventions, but it's not a huge improvement. And I suspect it would be a much bigger improvement if they were doing the diet. There are some case reports of people on ketogenic diets who had MCI, mild cognitive impairment. So nothing with severe Alzheimer's yet, but the earlier stage, where their MoCA score, the Montreal Cognitive Assessment, so they were, by these validated assessments had early stage dementia or mild cognitive impairment. And most of them had type 2 diabetes or metabolic syndrome, all the blood markers to verify that. And they go on a ketogenic diet, and lo and behold, 10 weeks later, 8 weeks later, the MoCA score is normal. It goes from mild cognitive impairment to perfectly normal. And of course, the triglycerides come down, the insulin comes down, all the things you expect to happen on a keto diet happen. And I show a slide often when I give these talks where I show that this MoCA score has gone from mild cognitive impairment to a perfect, I think it's 30 out of 30. Perfect cognitive health. And all the metabolic markers get better. And I just tell people that that is not a coincidence. Like, oh, this person reversed their diabetes, reversed their metabolic syndrome, and now their cognitive function is normal. Oh, that's interesting. No, that is not a coincidence. Of course, their cognitive function got better. You fixed the metabolic syndrome, you fixed the metabolic problem that was causing the cognitive problem. So I just think that's a really long answer to have I personally seen miraculous turnarounds? No, but only because really the vast majority of people who come to me, you can't do much. I think you need to catch it a little bit earlier, and you have to go whole hog. I don't think this is not something where kind of just doing a little bit is going to help. It depends. It depends really on the situation, but I think this has to be taken really seriously if somebody is very seriously impaired. I just don't think, I think the research will probably catch up to what we kind of already know or suspect. It's just going to take a long time for it to happen.
I've seen, I've seen clinically, and I want to say like, 20% improvement and sort of, some of the evaluations we do to assess dementia, and maybe not 20, 15% or, but just enough with the basics, with like just the basics. Go to sleep, get better sleep. If you have sleep apnea, treat the sleep apnea. If you can extend your sleep, extend your sleep. Sometimes some of my sort of geriatric patients, they're so vitamin deficient, and you just replete them and then they're just functioning better. You mentioned B12. And then, getting off medications that worsen sort of cognitive function. They're on clonidine, they're on clonazepam, they're on Ambien, they're on, SSRIs for some mild depression they had that's resolved. I mean, and you remove some of these agents, they're taking, antihistamines left and right? And you remove some of these agents, and all of a sudden it's like you get 2, 3, 4 more years, great quality years. And people say my parents are back, and that's such a joy. It's such a joy, and there's no study for that. And you mentioned, there's no literature for that. There's no literature for, I stopped the unnecessary psychoactive medications and my patient got better. I don't know. I mean, actually, there is the Beers criteria in the American Geriatric Society. They talk about that, eliminating medications. But really, there's no strong data to support it. And yet, sometimes it's so obvious and so common sense. I wonder, Laura, if you've seen anything like that before.
I've definitely seen similar patients who are on 10 medications, and there's no study when you have someone on 10 medications how all of those interact in the body. Most medications are not studied and how we end up treating patients often. And yeah, I've absolutely seen people who it seems like they do have some significant cognitive impairment, whether that's vascular dementia or Alzheimer's or something else going on. But really, you take away the meds, and it was benzodiazepine antihistamine induced dementia. So I have seen that as well. Yeah.
Yeah.
I think the polypharmacy is so under-recognized, and maybe not among you medical professionals, but among the people out there living with this and their families, their kids, their spouses. They don't realize, oh, it's the blood pressure medicine. My husband has been magnesium deficient for a decade, or it's the antacid. Like they just, and you have to wonder when somebody reaches a certain age, what is the point of putting someone who's 87 years old on a statin or a blood pressure? But again, I am not a doctor. Like I'm not trying to speak from that point of view, but what is being accomplished at that point? And I really think that side effects of drugs are underplayed. And when I coach people, and especially in the larger groups that I coach, we tell people, when some of these things that they report, well, is this keto? Is keto causing this? No. What's causing it is the medication that you've been on for 10 years that you never had this side effect before, but this diet is changing the way your body is handling that medication. And now you're having a side effect that you didn't have the last 5 years. But, we have to tell people to watch out for changes in the blood pressure and of course the blood sugar and all of these other things. And I think it's just not talked about enough. But that being said, doctors are busy. PAs, nurse practitioners are busy. Like it's on the patients too.
No,
When
don't
we
give
get a
don't let them off the hook,
What do you
right? They're the
mean?
ones writing the scripts. They're the ones writing the scripts. Don't let them off the hook.
Yeah, but
And
I mean,
here's what I actually
all
consider
right, I
bad.
won't let you off the hook. I'm not.
Yeah, here's what I actually really consider bad. When you're looking at somebody in the eighth decade, ninth decade, right, where they're looking for quality of life, like that's when we really have to think, okay, wait a second. This statin that they were on for an LDL of 99, right, that causes cognitive impairment, right? Maybe it's worsening their quality of life and isn't actually benefiting them right now. And that's what the Beers criteria talks about. It talks about, is this beneficial, at the point in time where they're taking it. And interestingly, statins cause a reversible cognitive impairment, right? So if somebody's focus is quality of life, and they're in their eighth decade, ninth decade, and they have this nominally elevated cholesterol, well, maybe consider stopping it or holding it or decreasing the dose or considering another agent. And there's so many medications like that. So I don't think it's not on the patients to know all that. How would they know that? I barely learned this myself. I had to look through, you're right, it's on the FDA website, but I had to go look it up myself. And I'm not anti-statin. I see some of my patients here joining us on the 1,000 people that are on the live stream. Some of those are my patients, and they know I'm not always, sometimes I'm recommending statins, very rarely, but I do recommend them. But my point is it's on us as clinicians to look at that whole picture. How is the patient supposed to know that?
Well, that I agree with. I'm not letting you off the hook there, especially with regard to the polypharmacy and the interactions of these drugs. But I mean, for any of the individuals, patients ourselves, if we take a drug, drugs come with those inserts. It comes with the warnings, and maybe some people don't have the ability to understand it all, but we need to be, hey, I'm taking this drug. I need to look out for A, B, C, and D potential side effects. So it's a joint thing. I'm not letting the medical professionals off the hook, but we're the ones taking the drug. It shouldn't be a surprise if you have such and such reaction when it's very clear in the literature that came with the prescription you took that it says that could happen. I think most people just don't do that.
Do you think that, I'm sorry, like Laura's trying to edge in and I see her leaning, I'm sorry, but do you think that this am I off base here to say, like, going back to the basics, sleep, stress, normal hours of sort of waking and sleeping, great nutrition, good supplementation. Like, do you think that do you think that, like, is it crazy to say, like, maybe just start there? Exercise, movement, exercise, like the amount of new blood vessels you get, I've heard it's 3 miles of new blood vessels in your brain when you exercise. I don't know if it's true, but it's something that crazy. I mean, am I off base to say start there?
No, I don't think that's crazy at all. I mean, where else would you start? I mean, I'll tell you what's not gonna help dementia. Crossword puzzles. No, I'm not saying the crossword puzzles are bad for you or word searchers are bad for you. If there's a metabolic fuel crisis in the brain, then all the little brain training games on your phone are not going to help. We
Amy,
need
we're
to
gonna
fix
have to stop it right here because Wordle sponsors us, so we're gonna have to end
I'm
this
out.
show.
I'm out.
I'm just kidding. Wordle does not sponsor us.
But yeah, no, I mean the basics, yeah. If this really is a metabolic issue, then how do you fix that? You eat the food that doesn't cause chronically high blood sugar and insulin. You get sleep, which plays a huge role in blood sugar regulation. You get all the nutrients you need. You get sunlight and fresh air. You move. To the extent that movement actually helps to regulate blood sugar and insulin sensitivity too, and helps the vasculature for anyone with a vascular type dementia. Um, I mean, I don't think that's crazy at all. Not only do I not think it's crazy, I think it's the answer. And it's kind of like Dr. Dale Bredesen says, and anyone who's really into Alzheimer's, I'm sure has heard of Dr. Bredesen. There are numerous different things that could be going wrong, and it might be a little bit different in everybody. So you just have to, what are the most likely candidates in my life? Is it my diet? Is it my sleep? Am I B12 deficient? Whatever. And address as many of those as you can. And the good news is most of it is basic stuff. It doesn't have to cost a fortune. You don't have to uproot your whole entire life. You just make a couple of small shifts, and that's going to go a long way for most people anyway.
I'm gonna
Yeah.
let you jump in a little.
No, I'm in 100% agreement. Yeah, I really am. I think there's also on the exercise front too, there's different hormones, brain-derived neurotrophic factor you'll hear about, but that exercise can have wonderful benefits from that perspective, increasing some of these hormones in our brain. And now there's more research actually with lactic acid actually being beneficial in our brain. And so increasing exercise enough to actually raise your lactic acid levels. So I think I never try to say use exercise for weight loss. No, use exercise for benefiting your body, your mental, anxiety, depression, many other things, insulin sensitivity. So I think that is a really important part if you're able to do that and incorporate that as part of your lifestyle. And then just going back, because I think it is on us even more so, which I think we're all in agree. Like the doctor, the provider you have does have to be really the help guiding with the medications. I had a family member actually who very well educated and was on medications for both high blood pressure and high blood sugar, and was having these episodes of shakiness and not thinking clearly and some different symptoms that they couldn't figure out where it was coming from. And I got on them a continuous glucose monitor, started having them track their blood pressure, and sure enough, their blood pressure was tanking, their blood sugars were dropping too low from their medications, and the doctor a 10-minute appointment with didn't have time to review what those side effects were. And even though they were educated, they themselves didn't make the connection to that this is coming from my medications. So just we've got to be on top of it, and I think really educate our patients well about things to look out for.
Yeah, 100%. I can't agree with you enough. I'm always do no harm, and what the physicians can sort of can figure out in conjunction with the patient. And you're so right with exercise. I mean, we kind of see it with our kids. Like, I see it in my kids. Like, you have them exercise, and then they come back home, they focus, they do their homework, then they go to sleep because they're actually tired, and then they wake up the next day and their brain is functioning on I think somebody has to do a trial. Somebody has to do a trial, a intervention trial in mild cognitive impairment, and the comparator arm should be getting crappy sleep, playing video games, playing Wordle on a blue screen all day long, feeding them Twinkies, right? And then compare it to, hey, walking, doing some resistance training, getting activity, getting good sleep, a great diet, and then measure the outcomes. It wouldn't take long, you know. So I don't know. Have you ever seen it? I've seen trials in Parkinson's and Alzheimer's for exercise, and I've seen like 10 or 15% improvement, nothing crazy. But if you add the 10 or 15% from exercise, 10 or 15% from exercise from a diet, you remove offending agents, that are sort of impairing cognition, you can get some magic. I don't know. You tell me, Amy.
I mean, I have, if I can share my screen, I have slides that show
Be able
there's
to.
1 or 2 case reports that kind of do exactly that. Let me see if I can. Actually, let me bring up the slide first before I,
Yeah,
I
yeah.
share it. Let's
Oh,
see.
let's make you a co-host before we and then make sure. Yeah, you should be able to do it. Yeah.
Okay, give me 1 sec. See if I
I
can.
made the error of letting anybody in a room be able to share the screen once. I'll never make that error again.
Oh yeah,
Yeah.
that can be fraught. So
Yeah. It was actually the first time we went live. We had like 150 people in a meeting room and then boom. Yeah.
okay, so if you can all see this, we have what, a 68-year-old male, and this is, a case report, but it's an example. He did carry the ApoE4 gene, which is the strongest genetic risk factor for Alzheimer's. He had mild Alzheimer's or mild cognitive impairment based on the MoCA score. He did have diabetes, and he was on insulin for 15 years. They put him on a ketogenic diet for 10 weeks, 8 hours time restricted eating or intermittent fasting, and a little bit of exercise 3 times a week. So again, he goes from mild cognitive impairment to normal on the MoCA score. His A1C comes down to a normal A1C, HOMA-IR massively down, fasting glucose, insulin, everything gets better. Then so this is another example. This guy's younger, only 38 years old, but also has the ApoE4 gene. He has metabolic syndrome and he has self-reported memory problems. He does have a family history of Alzheimer's. He was already running 2 or 3 times a week. Now they put him on a ketogenic diet for 10 weeks. They introduce the high intensity exercise and lifting a few times a week. He also goes, here we have the MoCA score from, MoCA score from 22 to a 30 out of 30, perfect cognitive score. They did actually verify that he was in ketosis with a blood meter.
Can we just repeat this for the listener? This is somebody going from needing, 4 to 12 hours of help at home, right? Forgetting their keys, not being able to drive, right? Just because they, the listener, sorry to interrupt, Amy, but the listener may not be able to understand what a 22 or 23 means. It means your family is deciding whether to take the keys away or not. Okay, that's what it means, right? This is somebody who cannot be left alone to somebody who's back to normal. Sorry, Amy, go ahead.
Yeah, no, but it gets better. So here we have here on the right, you can see the HOMA-IR, which is a measure of insulin resistance, is down 58%. His triglycerides are down 71%, reduction in BMI, the waist to height ratio, everything you would want to happen happens. And then again, if you look at that bottom left, he goes to a perfect 30 out of 30 on the MoCA test. And this is what I show people when I say that this is not a coincidence. When you fix the metabolic syndrome, you fix metabolic cognitive syndrome. There's actually, I have another slide that shows the associations now between metabolic syndrome and cognitive impairment are so strong that some papers actually call it metabolic cognitive syndrome. So yeah, when you fix the metabolic syndrome, you fix the cognitive syndrome.
You know,
So it's really fascinating. And yet those are case reports, but yet where are the large scale clinical trials? I guess you can't, and I hate to be a conspiracy theorist, but you can't patent this. You can't patent diet and exercise and sleep. So who's going to fund this? Now, I
I think
will
it's,
say though, the Alzheimer's Association in the US is actually funding some of Dr. Stephen Cunane's research. And Tro, I'm sure you know who that guy is. He's a researcher up in Canada who really does some fascinating research on ketones for the brain and specifically for Alzheimer's. And he's gotten some grants from the Alzheimer's Association. Yet, if you go to the Alzheimer's Association website, now it's been a while since I went there. I don't waste my time. But the last time I went there, there was zero mention of a brain glucose deficit. Nothing. How do you have a website devoted to this entire disease and not have one mention of the actual fundamental problem in the disease?
so I think they don't know the fundamental problem. I think when we see this, right, it makes sense. It's common sense, right? It's additive. We know sleep improvement, not eating all day, promoting ketosis, metabolic syndrome. We know the impacts. We know that it improves, brain performance. It reduces migraines, reduces seizures. It seems to improve some mental health issues. I mean, exercise certainly helps mental health issues. Um, we all kind of know this, and when you see case reports that strong, you can't help but make some decent conclusions. The problem is, how would you design that study? Like, like steak and eggs versus Hershey's and McDonald's, you know, like TV versus like walking, and you're right. A study like that costs, in let's say 10 patients to do a good lifestyle intervention in an assisted living would cost about $5 million. It's not possible.
Well, if we use some of that 1.6 billion going towards amyloid research to do it, it'd have a pretty
Yep.
good funding there.
If you are all joining us from social now, I'm going to summarize this in the last 2 minutes here of our live stream. Okay, we have the amazing Amy Berger, 3-time author. Go get her book on Amazon, The Alzheimer's Antidote and Your Carb Confusion, The Stall Slayer. And we've talked about a number of things. Dr. Laura Buchanan brought up amazing new research showing that the amyloid protein hypothesis, the original paper, was actually retracted due to fraud. It was cited over 2,000 times. We have spent billions of dollars of research on that hypothesis, and that an original study was retracted due to fraud. And we've talked about the last hour, the importance of lifestyle and metabolic health on cognitive outcomes. And I'm going to let Amy Berger wrap us up and maybe hit the main points before we part ways, and she can tell you all where to go, follow her, and support her, because we support her, we love her. So, Amy, anything I missed or needs highlighting, please highlight.
I just want to highlight one more thing before
Yeah.
Amy finishes up. There was a paper back in when was it, 2021 by Phillips et al. And they did a randomized crossover trial of a modified ketogenic diet in Alzheimer's, compared it to a usual diet supplemented with low-fat, healthy eating guidelines. And it was just a 2 12-week treatment periods. And the individuals, compared with the usual diet, the patients on the ketogenic diet increased their activities of daily living, their basically the ability to take care of themselves, kind of doing things like going to the bathroom. They improved their quality of life and compared to the other group. So that is the type of, this was a very small study of 26 people, but I think doing that type of study at a much larger level is exactly what you were talking about doing, and is what we need to do, just again at a larger sample size. This was in people with mild Alzheimer's clinically.
Yeah, if that's Matthew Phillips, I think you said Phillips, right? I think
Yeah.
he's out of New Zealand or Australia. He's done some really nice research on ketogenic diets for not just Alzheimer's, but he's got a couple of good papers on Parkinson's. And I remember one of his more recent papers on, I think it was Parkinson's, that some of the family members and caregivers reported that they were going to continue on the diet themselves because they noticed a benefit. They were doing it to support the person afflicted with this condition, but they got so much benefit from it. So yeah, Dr. Phillips is great.
Yeah.
Yeah, I don't really have much to add to what Tro said and what we've covered here, except that I really just want to offer hope. You know, Alzheimer's is kind of a really, really bleak situation if you don't know what we know and what we have discussed here. And again, keto is not any kind of slam dunk miracle cure, but compared to the utterly lackluster, if not overt failure so far of the pharmaceutical treatments, keto diets and like Tro and Laura were saying, just exercise, sleep, basic care and feeding of the human brain and human body is going to go a lot further towards supporting healthy cognitive function. And if you are currently living with this or a loved one is, do as much as you can in the early stage. Don't wait until this is so far advanced, because I do think there is a point of no return. I do think there is going to come a point where the impairment is so severe and the disease is so advanced that even hitting it from all angles, you're just not going to make that big of a dent. So like anything, early detection, right? I mean, the sooner you can catch it, the sooner you can do something about it. But I just want to emphasize that there's a lot we don't know about this condition still, but there's so much that we do know that isn't really getting out to the people who need it. So I think that we have a lot more power here than we think we do. So yeah, if you need help with this, call Tro, call Laura, call me, get in touch with us. We have potential help for you.
Awesome. Thank you so much, Amy Berger. Thanks for
Yeah,
joining
thank you.
Dr. Laura, all the health coaches here, everybody who's joined us. Wow, 1,000 views. Awesome. So Amy, thank you so much.